we do no credit check financing, which is a payment program to help all of those people that are not able to get regular or standard, as you would say, financing for their medical assistance.
Welcome to the Regenerative Warrior Podcast, Doctor's Edition, one of the fastest growing regenerative medicine and anti-aging podcasts in the world. Each and every Tuesday and Thursday, I talk to the top experts to show doctors how to market, manage, and magnify their practice to help more people and make more money. Each episode is short and to the point without wasting your time with pointless conversation. Learn the skills to be successful without traveling to seminars or paying for expensive consulting fees. Are you ready? Because I am. I'm Dr. Ross Carter, and it's time to start the Regenerative Warrior Podcast now. Two things before we get started. The views expressed by our guests are not necessarily those of Dr. Carter or this podcast. One of our podcast partners has just announced special pricing for our listeners. Wharton's Jelly Allograft for $475 per cc. You heard that right, only $475. White papers are available. This is for a limited time, so act now. Why pay double or triple the price from other providers? To learn more or to order, text your name and the word JELLY, Jelly, to 561-962-1231. Write that down. It's 561-962-1231. On with the show.
How did the business come about? How did this company come around, and what needs were they trying to fulfill to begin with?
We started as an in-house insurance company by our CEO, who is a physician, and his co-partner, who is a dentist. And even with their in-house insurance, what they found was it was really difficult to provide financing for patients who didn't qualify. So most credit loan companies, they all run credit checks. And if you don't hit a certain threshold, it kind of stops and they don't have anywhere else to go. And they were watching patients walk out the door, not getting the assistance that they need. So they decided to shift gears. And while putting the insurance side on the back burner, they began the financing aspect of things. This way they can focus on all of those people out there that are walking away without getting treatment because of past financial blemishes. So now we do no credit check financing, which is a payment program to help all of those people that are not able to get regular or standard, as you would say, financing for their medical assistance or needs.
What do you think is the main challenges doctors are facing right now?
I think that the biggest challenge for any practice is, one, they need upfront costs, which is very difficult to fulfill. And two, they face challenges in providing financing for their patients. Normally a credit check has a minimum of $600, maybe at the lowest, which is really not the standard anymore. There's been a lot of hardships over the last 5 to 10 years throughout the country, and it makes it difficult to keep those credit standards in line.
What problem does it cause when a patient has a low credit score?
It causes them to not be able to move forward with their treatment because the doctor cannot provide the financing options that they normally would.
What are some possible solutions that a doctor could do that could help them accept more care for financial hardship patients?
You may want to consider building packages for their patients, depending on the field, like for chiropractic, for example. It's good to have packages available, multiple tiered packages. This way they have the ability to say, okay, well, we can do this much for you at this cost, and it doesn't have to be all up front. You can even, some areas like chiropractic, you could take payments in-house if that's something that you're able to offer. It really does, again, depend on the type of treatment and care that you need. But if you can place them on any type of payment plan, I think really is the best way to help your patients really grow and get the treatment they need, because that's really what they need. So trying to fit in any sort of payment plan, while difficult, is the easiest way to be able to help your patients. We offer a monthly payment plan that you can spread over the treatment costs months, even years. There's no minimum and no maximum. You really can adjust the scale to meet the patient's needs. By doing this, you're controlling all of the financing features from cost to interest to duration, even by payment date. So by doing that, you could spread it out as far as you need to get the lowest payment possible for your patient.
Can you expand a little bit about how that works for a provider?
So when you use our system, what you'll do is you'll enter in your treatment cost to start. By doing that, you'll then move on to going to down payment if you wanted to take a down payment or not. The down payment's a really good way to help you, the practice, get some upfront costs to assist in any needs that you have. So say you had a $5,000 treatment cost, but you really need at least 10% down, $500. You would just work with your patient to see what really fits best within their budgetary needs. There has to be some compromise on both ends, I'm certain. The patient needs to understand that, yes, I need to pay for my treatment and I expected some cost, while the practice, of course, is there to help them with that. So in the example of $500 down, you would choose your interest rate. If you were to choose, say, an 11% interest rate, anything 12 months plus, you're not only going to earn a little bit of a revenue, but you're going to be able to provide your patient with some of the lowest payments available to them. So if I went anywhere from 12 to 48 months, they can have a payment as low as $145 with the 48-month contract at 11% interest. You can even at that point drop down the interest a little bit by playing with the math just to see if you can still meet your conditions and the patient's conditions.
Now, who is in control of the percentage rate?
You are as a practice. We have only one fee practices, and it's 10% per payment. It's flat. There's no interest included. So if you're looking to just help your patient and not earn an additional revenue, you really can go as low as you'd like. And we always just recommend that, you don't want to lose any money either. You have a business to run. So you want to make sure that whatever interest you charge them, you at least offset the amount of the fee so that you can still ensure that you're getting your full payment and at the same time being able to provide this service to your patients. So I'll take the 48-month example. So I had stated before that an 11% interest rate would get you $145.27 per month. And I'll do a little bit of math here. With a 48-month at 11% interest, with the compounded interest, the total payable amount is $69.73. If you subtract the 10% fee from that, along with the financing amount, you have netted $1,775 in interest over the 48 months.
So does the doctor get all of that interest?
He does. It's included in the payment. So it automatically balances out throughout the duration of the financing.
Sorry for the interruption again. To find out more about this speaker, become a speaker on our show, have Dr. Carter present at your event or podcast, learn more about coaching, consulting, tissue allografts, exosomes, supplements, legal help, or how to create $1 million business card and dominate your area, we're here to help you. Just text your name and any question to 561-962-1231. Write that down. That's 561-962-1231. Or go to our website at drrosscarter.com to learn more. Don't forget about our current $475 Warden's Jelly special. On with the show.
So as you could see, when you're at 48 months, you're still taking care of your practice. You're still providing the lowest payment for your patient. So it's a win-win both ways.
What is the fees towards the doctor? How much does the doctor have to pay for this service?
The doctor doesn't pay anything for this service. We don't have any sign-up fees and we don't have any monthly fees. The only fee, as I had outlined before, is a 10% per payment fee. That's it. To the patient, they have two fees. They have an enrollment fee of $30, and it's one time only per contract. And they have a $3 a month transaction fee, and that's it.
Tell me about what is required for the patient in terms of like a credit score.
No credit score. There are no credit checks.
So this could be applied to anybody?
It can be applied to anybody. All they need are two forms of identification.
So let's say a patient decides to do this process and they put their money down and then 3 months down the line, they stop paying. What happens with that for the doctor?
Well, in that case, we'll take over. We guarantee payments to the practice if you meet one of two criteria. If you were to take a 10% down payment, you automatically have a guaranteed payment. If they're not able to make that 10% down payment, because again, on larger treatments, it's going to be a considerable amount of money, you can ensure that as long as they make their first scheduled payment, it then becomes a guaranteed contract as well. So if they were to default, we'll take over, assisting the patient to collect or make their payments on time. And we do our best to work with your patients and their needs as well.
So how does that affect the payment to the doctor?
Doesn't affect it too much. All it does is if the patient is delayed, we'll push your due date to 30 days, but you will still receive your payment. It's guaranteed.
But you would basically move the payment another 30 days, so you would have to wait another 30 days?
It would just be 30 days from the due date. So if, say, their payment date was the 15th, it would be 30 days after that.
So the doctor would miss 1 month of payment. Is that correct?
About a month, yeah. But they still receive their payment either way. We are very successful at assisting the patients make their payments.
So you're saying that if a patient puts down a 10% down payment and agrees to the terms of the agreement, that regardless of what happens in the future, the doctor will still be receiving monthly payments even if the patient doesn't pay?
The the practice does. That's correct. The only caveat, just so you are aware, is if the patient were to file a dispute with their bank. So say that they decide a few months down the line that their payment that they're making or whatever it may be, they decide, oh, you know what, I'm going to file a dispute. I don't want to make these payments anymore, but they receive the treatment. Well, we fight that dispute on behalf of the practice. So we will take care of that as well. Now, payments will pause, obviously, because there's a dispute in process. So disputes can take anywhere up to 90 days. You know, it really depends on the bank and the process. But, you know, that comes hand in hand with providing any sort of financing. It doesn't matter if you're giving no credit checks or credit checks. People file disputes every day. So it's just a matter of us being able to step in and swiftly respond, which also means that, you know, we will reach out to the practice and let them know. We'll pick it up again.
So if there is a dispute filed, the maximum period of time of the payments will be paused for 90 days. Is that correct?
It is generally 90 days for all disputes to be fought with banks. That's correct.
Regardless of what happens with that dispute, the payments will resume after that period of time?
Yes, the payments will resume because we will have one with the patient, which means the payments will pick back up within their account. And that means that you'll receive your payments again as well.
What about if a patient, say, 6 months after a period of time, files for bankruptcy?
We will go and file the documentation needed with the bankruptcy court, and we will submit ourselves as a lien with their case, essentially. So depending on the bankruptcy chapter that they're filing, which will come on the paperwork, from that patient, will determine the outcome of that. So unfortunately, if they're filing and it's one of the 100% loss where there is nothing that can be collected, that means the practice would not win anything out of that. But usually if it's a lower grade bankruptcy proceeding, there's usually payment plans that the courts will require them to go onto so long as we submit ourselves as a debtor.
And you take care of that automatically? The doctor doesn't
Absolutely.
have to do anything?
Doctor doesn't have to do anything. Yeah. It actually comes straight to me, so I file it immediately.
So as long as there's not a complete dismissal of all debt, then the doctor will still be receiving their payments?
Yes, they'll receive their payments once the outcome of the bankruptcy has been provided. So it really is up to the bankruptcy court on how much or how little will be gained from that.
What type of medical practices can use your services?
You could be anywhere from a chiropractor to cell rejuvenation. You could be a medical practitioner. You could be medical billing. You can be a yoga instructor who does retreats. You could really be anybody. So, we have a very large genre that can use our services.
Thanks for listening to our podcast. Please subscribe to be notified of all new episodes, and also like and share this to help us grow. To find out more about this speaker, become a speaker on our show, to have Dr. Carter present at your event or podcast, learn more about coaching, consulting, tissue allografts, exosomes, supplements, legal help, or how to create $1 million business card to dominate your local area? We're here to help you. Just text your name and your question to 561-962-1231. Write that down. That's 561-962-1231. Or you can go to our website at drrosscarter.com. That's drrosscarter.com to learn more. Until next time, this is Dr. Ross Carter, signing off.